New at 5, alarming results from a San Antonio-based study on pregnancy and diet drinks. It may have you reaching for a glass of water instead. Local researchers concerned with their findings, which one doctor says should be a wake-up call to anyone who sweetens their drinks with aspartame and is thinking about having a baby. The study at UT Health San Antonio asked the question, what happens to a baby in the womb when the mother drinks diet drinks during pregnancy? The answer stunned Dr. Sharon Parton-Fowler.
What we saw was that among boys with autism, the odds that their mothers were drinking one or more diet sodas per day or using the same amount of aspartame as would be in one can of Diet Cola per day, they had tripled the odds.
They were looking at children who developed autism later in life, but also those who had symptoms from the start. They had an even higher risk, almost quadrupled. Oddly, she says, the girls showed no added risk, something that's shown up in other studies.
Whether it's diabetes, pesticides, whatever, they're 6 to 8 times more vulnerable to those experiences that might cause neurodevelopmental problems compared with girls.
And if you push aside all those diet sodas and maybe make yourself a nice hot cup of tea, if you use these packets, the doctor says you still have a problem. I've learned to love water.
Learning to love water. Yes, exactly.
Keep in mind, this is not the first study to reveal that there could be a strong link between disease and diet sodas. Some people develop neurological issues, only to later find them disappear when they stop the soda habit.
So about 10% of the aspartame anyone puts in their bodies turns into methanol, which turns into formaldehyde and formic acid, which are very toxic.
Now, she says that more study needs to be done on the issue, but for now, the doctor and other researchers are stressing that grabbing a diet soda while pregnant is not a healthy way to keep your weight down. It's more likely putting your health and that of your child at risk.